Well, welcome to the laser room here on the Flying Eye Hospital. I'm very pleased to be joined with Dr. Jasmine, who's the retina doctor here in Chittagong, as well as our volunteer faculty member, Dr. Peter Kertes from Canada. One of the things I'm very pleased about is the partnership that Orbis fosters from the best doctors throughout the world, different nations coming together to give the poorest and most blind people in the countries where we're serving the best care possible. I just wanted to first start with hearing from Dr. Jasmine about your experiences with Orbis and this training program so far.
Okay, it is very fine. After working with Dr. Peter Kertes, I learned a lot of my issues. I have so many problems with my patients, and that are solved. And so many confusion during diagnosis are about the management. Those are solved. Thank you, Curtis. Okay.
And Dr. Kertes is really focusing on a lot of diabetic eye care. Diabetes is a growing problem in Asia, and specifically here in Bangladesh. I just wanted him as an expert to talk about the conditions he's seen and the importance of diabetic eye disease.
There's no question that diabetic retinopathy in Bangladesh is a huge problem, and it's a neglected problem, and it's a growing problem. My experience with Dr. Jasmine has just been wonderful. She's really, I think she's an inspiration to us all. She's the only medical retina specialist in all of Bangladesh, and she has an enormous and difficult problem ahead of her, and she's managing remarkably well, given the scope of the problem and the scourge of visual loss from diabetic retinopathy.
And, lastly, tomorrow is World Sight Day, and as all of our viewers know, World Sight Day, the theme is gender inequality in eye care. I wanted to hear from Dr. Jasmine about her thoughts about 2/3 of the world's blindness affecting women and how that plays out in Bangladesh.
Well, it is very large problem in our society. Our females are illiterate. They are ignorant, and they are not dominate the society. They are dominated by the male persons, and they are not plan makers. That's why they don't approach the treatment system. That's why they are suffering from more of cataract, the large problem or large issues, and diabetic retinopathy, and so many like traumas, family traumas, etc. It should be changed. We should make more awareness between females, as well as there is increase the awareness of the male populations also, because the females are the child are cared by the female person, by their mother. If mother is healthy, if their vision is good, then they can learn more their children.
And again, I think that's such a key role, knowing that the mother especially is such a cornerstone in the family, and blindness and poverty are related, both as cause and effect of one another. And it would be so nice to be able to remove gender as one of the problems that are facing the patients here in Bangladesh. Thank you very much again for joining us for World Sight Day. And again, I want to thank Alcon for their continued support of Orbis, this Flying Eye Hospital program, and the work that we do. Obviously, while this year's theme is gender equality, we are going to continue to work next week with oculoplastics, retina, as well as glaucoma. Again, I want to thank all of your viewers to realize how important sight is to all of us, how this is something we should all be involved with, and that this year's theme of gender inequality is something that we hope to address going forward, both at Orbis, but as a community and society. Thank you.